Welcome to the Career Changers Podcast, the podcast that bridges the gap between your passion for nursing and your dream job. Whether you're a seasoned nurse looking for that perfect role or a new nurse eager to embark on your professional journey, our show is a compass in the world of nursing careers. We will guide you through job opportunities, insider insights, and inspiring stories that will empower you to land the job of your dreams. Join us as we explore diverse nursing avenues and help you find your path. Get ready to make the career leap because Career Changers is here to connect you.
Hello, welcome to the Career Changers Podcast. I'm Tracy Peterson, Talent Partner with Mainline Health. Today we're bringing you information about our Perioperative Fellowship Program. My guests today are Sarah Queter, Lead Clinical Nurse Educator for the operating rooms for Mainline Health, and Jessica Gallagher, a stat nurse with Mainline Health who went through our Perioperative Fellowship back in 2014. Hi, Sarah and Jessica. Thanks so much for being here today. Before we get into the Perioperative Fellowship, can you both share your career paths and journey with Mainline Health?
Sure. Hi, Tracy. Thank you so much for having us today. My name is Sarah Queter. I am the lead clinical nurse educator here for surgical services. I've been at Mainline Health for 10 years, almost 11. I've been an OR nurse for 16 years. My journey with Mainline Health is I was a nurse educator for Bryn Mawr's operating room for 6 years. And for the past 5 years, I've been the lead of education for all surgical services for pre-admission testing, pre-op, OR, and PACU.
Awesome.
My name's Jess Gallagher. I am a stat nurse for the operating room. I started working at Mainline Health in 2011 while I was in nursing school. I was an extern in mother baby. I graduated and took a residency position. During my first year, the fellowship opened and it sounded interesting. So I applied and was accepted, and now I'm here.
Thanks so much. You obviously both have a passion for nursing. So, Sarah, let's get rolling. If you could share with us why Mainline Health created the Perioperative Fellowship Program.
Sure. So when I came to Mainline Health in 2013, I noticed that we did not have a formal training program for establishing nurses within the operating room. We had used kind of ad hoc programs as well as partnerships with surrounding colleges and universities, but Mainline Health itself did not have a way to onboard and train both their own nurses who wanted to transition to the operating room as well as external people with outside of Mainline Health who were interested in joining the operating room. So in 2013, I worked with nursing leadership as well as HR, and we developed our first cohort of the Perioperative Fellowship, where all 4 of our acute care campuses took 2 nurses at a time, and we brought all 8 nurses together and trained them to the operating room. And Jess was a part of our first inaugural group. So the program itself has been around for roughly almost 10 years. We've onboarded over 150 nurses since that time.
Can you provide an overview of how the program is set up?
Sure. So we are unique here at Mainline Health where we offer it's a three-prong approach to the fellowship. What sets us apart from other formal perioperative training programs is we offer both AORN modules. So AORN is our governing body, the Association of Operating Room Nurses, where they offer very detailed didactic modules that we offer to our students. Along with that, we also have personalized simulation approaches where you work with an educator at your campus to take what you learned in those modules, and then we practice them real time in a controlled simulated environment. And then after that, you take all those skills that you practice with us, and then you do them real time in the operating room with a preceptor. So the structure of the program is the first 4 weeks are heavily into a lot of controlled education and simulation and learning. And then after that, it's about a 6-month program where we rotate you through all of our specialties in both the circulating and the scrub role. So a specialty to us could be anything from urology, plastics, general surgery, orthopedic procedures. So we really expose you to all the procedures that we do at your campus, all of the surgeons that you'll work with, and the different patient dynamics that you would be exposed to.
Okay. So it's about a 6 to 9 month program.
Correct. It's about a 6 to 9 month program, which is pretty much the gold standard for operating room training programs of hospitals of our size.
Okay. And are there any tests or certifications?
Yeah, so we actually offer an exam. It's actually structured for the middle of the program, and that's purposeful. So we take what we taught you in the first 4 weeks, we have you practice it for a couple of weeks, and then we test you based on both the knowledge and the skill that you have. It is an online exam. It's incorporated again through our governing body, through AORN. And really what it does help you set up for success if you do choose to sit for certification, which we do support about 2 years after program completion. So it gives you a really nice foundational base and touch point for where your knowledge is.
What support is there for the nurse fellow going through this program?
So there's a ton of support. So all of our campuses are very much engaged with this program. And we really, we try to offer an environment where you feel supported throughout this process. It's not an easy program. It's pretty daunting. It's Monday through Friday, 5 days a week. Repetition is key for us. So the support that you have on the unit, it's from the bottom up and from the top down. You're supported every single day by preceptors within the operating room, your educators. We work very closely with our coordinators, our clinical coordinators, to make sure that your day-to-day is set up for success. And then we also have weekly touch-base meetings with our assistant nurse managers and nurse managers to make sure that you feel as if everybody is well aware of where you're at with your status within the program, as well as any additional support that you might need.
Okay. And is this program for experienced nurses or nurse graduates?
So we offer 2 different cohorts for this program. So we offer cohorts for experienced nurses. So as long as you have 1 year of acute care experience, we do accept you to cohorts, as well as new grads. We started accepting new grads to this program in 2015. And between both new grads and experienced nurses, we have about an 82% retention rate after 2 years, which is well above the benchmark nationally.
And how often does Mainline Health offer the program?
So the program is offered multiple times throughout the year. It really just depends upon the campus and what you're interested in. We try to offer this program at least twice a year at all of our campuses. So all of our campuses have a different flair for the specialties that they provide, if they're trauma-based or not. So it just depends what style of operating room you're interested in. But chances are that you would be accepted twice a year to the program.
So Jessica, you're a true success story for our perioperative fellowship program. How has this program prepared you for your nursing career?
I feel like it was a great foundation. I learned a lot. I did my fellowship at Lankenau. I had a lot of support from the staff there, who I currently still see as a member of the stat team. There's a few at Riddle. There's still some at Lankenau. There's some at Bryn Mawr. They were great working with us and took time to really show us the ropes and make us feel comfortable.
And how did your career path lead you to your current role on the stat team?
So I was full-time at Bryn Mawr before I joined the stat team, and I felt like from working at both Lankenau and Bryn Mawr, I saw a lot of different types of cases, and the stat team was new for the operating room. I thought it would be a good experience, and you get to see all of the campuses and all their different specialties and trauma and whatnot. So I applied, and I really like it.
So let's talk a little bit about the application process. As the talent partner for the Perioperative Fellowship, I work closely with Sarah and the other OR educators at Mainline Health from application, interview, and offer process. If you're a new grad or an experienced nurse with at least 1 year of acute care experience and have a passion to want to work in the OR, we urge you to apply. Once your application is reviewed, you'll hear from me to get the process started. It starts with a phone screen, and then we give you the opportunity to shadow and interview the same day at the hospital of your choice. We want to make sure that you're a fit for us and that we're a fit for you. So, Sarah and Jessica, just one final question for you both. Why is working at Mainline Health not just a job, but a career?
Sure, I'll go first. So I've never worked anywhere else, but I would say I think
Awesome.
it's great. Some of my best friends are from working here, and I get to see them. They make my day a lot better. Can't complain. The role in the OR, you work closely with everybody, surgeons, anesthesia, scrub techs, ORAs. It's just a nice environment.
Sarah?
Sure. So coming from an outside facility and joining Mainline Health, it's almost immediate, this sense of pride that our nurses have with taking care of patients within our community. I would say from working both at Bryn Mawr and Riddle, and I can also speak for nurses at Paoli and Lankenau as well, our job in the operating room is very unique. We are, as the nurse in the room, we are the patient's advocate. So when patients leave their loved ones in the preoperative area, it's our responsibility to make sure that they are very well taken care of. And there's a lot of trust that's put in us. So I would say what makes this a career here, and what kind of sets us apart, is that chances are that you are taking care of somebody's family member or neighbor or somebody who is tightly knit within our community, or a member of our community. And we take pride in that. We take pride in making sure that you are very, very well taken care of, that you have highly skilled people within your room that can handle multiple situations, to make sure that our patients have the best outcome. So I would say, coming from an outside institution, that's what kind of sets us apart at Mainline Health, is just the sense of pride and camaraderie that we have within our teams. We work very hard at not having a hierarchical system within our operating rooms. It's very much an even playing field with communication and teamwork and mutual respect amongst our team members. So coming here as a patient and coming here as a nurse, it's very much felt that you have a team of people that are dedicated to taking care of you.
This has been so informative. Thank you so much for joining me today. That's all we have time for.
Thank you, Tracy.
Thanks for joining me.
You have been listening to the Career Changers podcast. Moderators include Nicolette Biscani, Abigail Metzler, Tracy Peterson, Cheryl Moldy, and Connie Samulevich. Music is by CapCut. Our executive producer is Christina Archer. Our technical support is Paul Fort. Thank you for listening. We hope you join us for our next Career Changers podcast.